Fat transfer. This is a question that I get asked almost on a daily basis now, and fat transfer seems to be really popular. Now, fat transfer has actually been around for a long time, and there's a gentleman called Sidney Coleman, who is a doctor in New York, who was really probably the first gentleman to recognize the importance of fat moving from one place to another. Now, he popularized the technique, Sidney Coleman, by moving fat from one place to another, specifically the face, to help volumize, to fill up, and to help minimize lines. The problem was that there was simply an issue about taking fat from one place to another means that you're creating what's called a graft. And a graft is essentially material that does not have a blood supply. So it needs to, when you move it to a new position, it needs to develop a blood supply. And this is what a graft is. So initially, some of the concepts of moving fat from one place to another was that it was associated with a degree of absorption and lack of a blood supply. And so we lost some of that fat when we injected it into various areas. And therefore, over the last 10-15 years, there's been a huge amount of research into trying to develop the optimum methods of processing that fat, harvesting the fat, processing it, and then putting it into the recipient area. And that may be the face, the breast very commonly, and also as many of you will be aware, in the bottom as well, the buttocks. So the whole concept of fat transfer is really exciting, and we've seen huge changes in how we process that. And so technology has been very instrumental in our advances in this regard. I'm very lucky that I use a very high-grade method of processing fat using a proprietary technique called pure graft. And in my opinion, pure graft is probably the most advanced method of fat transfer processing out on the market today. And I'm very proud to be offering my patients this technique. Seemingly it's very simple, but also very advanced in that we've got multiple filters and methods of washing the fat so that we can create very high quality pure fat that we can then transfer into the recipient site. And this method of processing means that our take rates, i.e. the ability of that fat to get new blood supply around the fat globules, means that the take rates are much higher. Therefore, you get much more volume, much better results, and the consistency of the face or the breast or the buttocks is much better. So we're very excited that we now have these advances, and I recommend this for all my patients if they wish to pursue fat transfer. There's other exciting advances with fat transfer as well, because we now also know that fat transfer is associated with regenerative qualities too. And this has spawned the whole concept of regenerative medicine. Stem cells, or adipose-derived stem cells, we now know that the fat is probably the most potent source of stem cells in the body. And this is why plastic surgeons have been leading from the front in regenerative medicine through their efforts in using fat to put in other areas of the body. And we know that other medical specialists such as orthopedics, rheumatology, as well as plastic surgery have been using this knowledge of stem cells derived from fat to benefit their patients as well.